I'm Benjamin Hall, and I'm searching for heroes. Well, hi everyone, and thank you so much for joining me again today on the podcast. Look, I hope that every one of you is enjoying some warmer weather, and frankly, that you're enjoying life. And look, for those of you who are maybe struggling right now, or who might have gotten some bad news recently, well, actually, I'm with you. A few weeks ago, someone in my family, not one of my daughters, but close, just 8 years old, got the devastating news that they had a brain tumor. On top of that, the removal of the tumor caused something called cerebellar mutism syndrome, which meant that she lost the ability to move half her body and couldn't speak for a while. It was incredibly scary, obviously, and it was heartbreaking to see this young, innocent child have to go through something so terrible. But at the same time, it reminded me of the incredible strength, the incredible resilience of children that they often have when they're faced with traumatic situations like this. It also made me feel so grateful for the pediatricians that were there to care for her and to assure us that they were going to do everything in their power to make sure that she was okay. The good news, and we're holding onto it tightly, is that the tumor is not cancerous, which we're incredibly thankful for. But there is still a long road ahead, and your thoughts, your prayers, they would really be truly appreciated right now. And on that note, I'm especially honored to welcome today's guest, Dr. Jerry Loughlin. Dr. Loughlin has an incredible career as a pediatrician, receiving many awards and international recognition for his authority on pediatric respiratory diseases. He served as the chair and pediatrician-in-chief at the New York Presbyterian Weill Cornell Medical Center and Phyllis and David Komansky Children's Hospital from 2002 to 2020, leading his hospital in New York City through the pandemic in a way only a true hero could. So, without further ado, let's dive into the conversation. And I hope that you enjoy hearing from Dr. Loughlin.
It's really impressive what the children are able to bounce back from and get through. It's really impressive.
And starting on that, why are they able to bounce through things so quickly? What is it about a child's mind or their personality that allows them to do that?
That's a really great question. I'm not exactly sure I know. I think that it's probably that they don't have all the life experiences, so they know. When we're adults, we know all the bad things that can happen, and I think there may be a factor in not having that experience, those experiences that allow them to see beyond what's going on. I think also the support around them is really important. So parental family support is absolutely critical to that getting through a process. So we see very often if mom and dad and brothers and sisters and aunts and uncles can all be optimistic and positive, that the child senses that and stays with that, and that allows them to help to get through that, I think.
I'm sure you've seen sort of both extremes, and parents who know how to handle it well and talk to their children well, and those who don't. And what direction do you give to parents, when their child is going through something really traumatic?
Well, the most important thing is to always be honest, and you don't hit them in the head with the bad information. But if they ask a question, I had a patient once who was I'm a lung doctor when I was practicing medicine, and we dealt with an illness called cystic fibrosis, which in the past children died at young ages, in their teenagers and even younger. And I'll never forget one morning when this young girl who was about 9 or 10, and her parents, everybody there, and she was very sick. And I walk into the room and we start talking, everything. And all of a sudden, out of the clear blue, she says, "Am I dying?" And so you could have heard this hush in the room. So I sat down next to her and started talking to her and told her, yeah, I thought that's what we thought was going on, and wanted to know what she thought about it. And she thought so too. And then I said, well, do you have any questions, other questions than that? She said, no, not now. So I said, look, I'm going to go finish my rounds and I'll come back and then we'll talk again. So I went away, came back about an hour now, 2 hours later. And I said, well, do you have any questions? And she said, yeah, when is this going to happen? And I thought, what a strange question. But if I realized that a child in the hospital we tell them when everything's going to happen. We tell them when they're going to radiology, when they're going to eat, when they're going to go to the operating room. And so she figured I must know the answer to that question. So that opened up the opportunity to discuss the kind of death and dying process. So I think being honest is really important because they know. It's almost like an inner sense of when people are giving them, not telling them what's going on, and they'll know. And then try to adjust it so you got to watch your vocabulary. You can't use words that maybe even adults don't understand sometimes. So you got to make sure you're at the appropriate developmental level. Involve the parents. It also depends on age. So we use our child life people and our developmental pediatricians, because what you're going to say to a 4-year-old and a 9-year-old and a 15-year-old are really different things. And so it's a team, becomes almost a team sport in terms of how you're going to deal with the child and answer their questions.
Can I ask what happened to that girl?
She eventually did pass away, but again, and that was a tough thing for her family, because it was interesting, because that was kind of ties into my story, is that the parents didn't want us to tell her anything. Till they wanted us to just let this be quiet. And so we're in the room, and now you're on, everybody's there, and then she's asked this question, and I'm thinking, look, I can't lie to her, because that would destroy our relationship. So I told her what it was. And, the poor mom and dad were going through it for a while, but they did adjust to it. And then they were able to help her go through that last process. They were able to bring in brothers and sisters so people could come in and be with her and spend some time with her during those last days that she had on Earth.
Do you notice sometimes a difference? Are there some children in hospital who want to just go and fight for every treatment? They want to work hard, and others who don't? And if that's the case, what is the difference between them?
That's a great, I'm not sure that it seems like they'll want, everybody wants to try to do stuff. They get tired of it. Some of the procedures that we do are painful. We try to minimize the pain associated with it, distract children as best we can. But I don't get the sense, in my experience, having children just give up. Now, as they get to be old, we've had that cystic fibrosis disease patients would get into their 20s and the like, and when things mounted up against them and they were sick all the time and they were coughing and they weren't able to get through the day, that's people who just would at some point would say, look, why are we doing this? So one of our agreements with that disease is we rarely put a child with cystic fibrosis on a ventilator, when their lungs fail them. And what you would do in most settings is put a child on a machine to help them breathe. We didn't do that very much with those kids. We just made their last days be peaceful with family, with friends, as the best as possible.
I suppose it raises so many questions about parenting, not just in hospital, but outside of hospital. I mean, you would hope that those same morals, those same level of education, talking to your parents, should be the same in and out of hospital. But I think maybe you might notice that it's suddenly very different.
Yes, and that's the other thing that we do have to factor into these situations is the, kind of educational level, the emotional quotients of the parents, and that's part of our job as we're dealing with a child in the end, is to make sure we understand what the family dynamic is and what the experience of the parents have been. Are there two parents? What experience have they had with significant illness in the family? Some families have had other children or parents with significant illness, and that kind of influences how we approach talking to them.
I imagine also just the relationship between siblings is something else you have to talk to them, both the sibling about and also to the patient as well. And, how you tell the sibling of someone in hospital, a child, how they could get through it too.
Yeah, so that's why we incorporate them into one of the things about pediatrics is it's the in the hospital, the rooms are really pretty. In most adult hospitals, children are limited visitation to the adult hospital for concerns around infection and the like. In the pediatric units, we accommodate the family. So if we have a child who's sick in the hospital, we want brothers and sisters to come in and spend time. So often you'll go into a patient's room on a pediatric ward, and there'll be people playing games and watching TV and doing other things with the child. Often they're the brothers and sisters or cousins or close friends, and that's really an important part of the process is to bring everybody around to support them.
What has working with ill children sort of taught you about strength, about vulnerability, and were there things that you didn't expect that you have learned along the way that you weren't taught in medical school as well?
No, there were no courses like to do on this. You're right. Well, I think they've taught me. They teach all of us a lot, of the pediatricians a lot too. You got to be paying attention to what's going on. They've taught me. I think the question that you started earlier on about the resilience, I've come to appreciate tremendously what children are able to go through, still come back and play a game and be a watch, say they want to watch a favorite TV show, that even though they've been very sick and they may not feel very well. So that resilience has and that inspires us to keep going, because we know that they believe that there's a positive outcome here and they're going to get through this and move on. They also are very interestingly able to kind of erase some of these bad experiences from their memory banks, which is good, because the babies will remember. It's really interesting when we deal with little babies. There's a way you draw blood from a little baby by doing what's called a heel stick. So you have a little needle and you stick it in the heel and they'll blood, and you collect a small amount of blood. Those neonates, as they get older, if you pick up their foot and hold it in a way that you would to do this procedure, the baby will tense up. You feel them tense up right away. So they remember this is not going to be a good experience with what you're going to do. So it takes a while, but they can erase it and go on and do great things with it.
Hmm. Do you sometimes have to look, you presumably, some children, particularly if they become teenagers, might be trying to hide how they're really feeling. And I suppose you sometimes have to keep a close eye on that and really also be monitoring them when they might not be so open with you.
Yes, you really, and those kind of nonverbal clues are really important. You watch what they're doing. Are they interacting with their peers? What are they doing? Are they kind of isolating themselves from the rest of the community? Those are things that we look out for in our teenagers, and make sure that they're doing the things that teenagers do. Sometimes they're crazy stuff, but we watch to make sure that they're doing that and they're not withdrawing. We watch how they're doing. Are they avoiding things, avoiding social settings, like going to school, when even though they feel well, they're trying to not go into a school setting. So those are the kind of things we watch out for, and you rely heavily on the parents' observation of their child.
More of our conversation right after this. It can't be easy for you as a doctor seeing, sick and ill children so often. I wonder, are you able to sort of shut the door when you go home? How do you sit down and evaluate and think about, what's your process after a really difficult day, perhaps? So putting it to the one side, or do you have to think about it more?
No, you try to put it aside, because I had two daughters as well, and a spike and a wife. So I felt that it was important to kind of compartmentalize that. When I was away from it, I could put it aside, and I didn't let it kind of drag me down. And it was always there, but I didn't let it kind of influence what I was doing. Although it did make you really alert. So when your own child does something, I have a list of bad things that it could be. So it was important for me to always be able to process that silently and away from everybody else. But no, I could deal with it. I think that's part of being a pediatrician, is that I can tell. I have colleagues and friends who are internists and adult surgeons, and a sick child is just an anathema to them. They can't deal with it. Whereas I could get in there and deal with it, understand that there were going to be some downsides to all of this, but come through it. And I think that separates out the people that choose pediatrics as a primary discipline from someone who is an internist. And then you're also getting a lot of you have to pay attention to visual cues, because in younger children, we're not going to have a conversation like you and I are having now, because they don't have that level of sophistication. So you have to be able to sense what's going on in their behavior.
Well, why did you pick pediatrics?
That's That's a great question. I love kids. It's probably one of the things that I love being around children, and so that was good. I liked the idea, the discipline of medicine that was internal medicine, because you were thinking about, you would be presented with a problem. It might be a cough, or the cough may be just that the kid has a little cold, but it could also be something significant. So I like the discipline of going through that, figuring out what was going on. That's what the internal medicine people generally do for adults, because they'll present, an adult will show up with chest pain or abdominal pain or something, and they have to figure out, well, is this something really dangerous or bad, or something that can just pass by. So I wanted to combine those two, the two things. One is being with patients I like, which were children, and I think the other thing that you started about earlier is the optimism was important to me, that the patients I'm dealing with were optimistic about the future.
Mm. Do you think that there has been a lot of progress? I mean, I know there has been progress, but say in the last couple of decades in particular, in pediatric medicine, cystic fibrosis, some of these other illnesses, how much has the improvement jumped up?
The progress has been staggering. CF is a great example. When I started, so that's 50 something years ago, the median survival for a child with cystic fibrosis was probably in the 9, 10, 11 years of range. It's now in the 40s and 50s. And so now, in fact, cystic fibrosis has become an illness that is managed much, much more by internal medicine doctors than pediatricians, because the patients are living longer. A cancer is another thing. If you look at lymphoma in children, the survival rates are in the 90% range. So there's been tremendous progress with managing all sorts of disease, intensive care. We take care of, again, going to looking at premature babies. When we started, a baby that was born at 28 to 30 weeks gestation, I remember normal pregnancies 38 to 40 weeks. Those are the ones that we were able to save without kind of significant problems. Now we're looking at babies that are 23 and 24 weeks gestation, and get them through it and they go on to school. They do all the good things that everybody else does. So the progress is just staggering. When I started, one of my mentors took me in a hallway and he said, look, we would walk around the rooms and the kids, and he'd say, look, the children would say, look, he said, when I started, everybody with that disease died. He said, now they're all living. And I have that same experience. When I started, a good percentage of the patients that we saw did not make it or didn't do very well. Now they're doing well. They're staying out of the hospital. A lot of the care is in the outpatient setting. Those are all tremendous advances in care.
If you could change something, if there's one thing in terms of pediatrics and treating kids that you really think needs to be changed or be find new direction for it, what is that?
Well, I think the one thing is again not dismiss them just because they're children. There's a real tendency because we're dealing with children, to not them to get the same level of resources and attention. Pediatricians are one of the lowest paid specialties around, and to me, it sends a mixed message about, everybody says, "Oh, we value children," but look at what we pay doctors and nurses and school teachers, people who take care of children. It's a reverse. Makes me think we don't value them as much as we should. And I'd like to have people have more respect and reflecting that in the way the disciplines are treated for people who provide care to children, and also teachers, nurses, etc. It's not just doctors.
Yeah, because they're our future. I mean, if there's one place you really are going to invest, who you have to be teaching and looking after, it is the children.
That's right. Yes, and if you're going to live with a chronic illness, if you don't deal with it early on, that illness can turn into a much, from a societal standpoint, much greater burden, not only to the child and the parents, but also to the society at large. We really believe that if you deal with these problems earlier on, the long-term impact is huge. And so that I'd like to see that change. I'd like to see our mentality be more future oriented towards what the value of investing in pediatrics is.
What do you think, taking a step back and looking at the health of young Americans, American children at the moment? We talk a lot about diet and, is illnesses jumping up? Is there more of it? Do you think that despite the improvements in medicine, are maybe the youth and the children living less healthy lives?
Yeah, I think we're a little worried about the sedentary nature of children, that they're not as active as we'd like. I mean, um, I see it in my own grandchildren, the video games, the
Mm.
on their phones and stuff. They're spending a lot of time, and I'm not sure we're seeing the full term, what's going to be the outcome of all of that time they're spending on a video game, rather than when I was growing up, you were outside playing ball with your buddies. You were not at home sitting and watching the TV. These guys can be on their computer, on their phone. If they're with have a phone, they can play games wherever. Get on, if you get on a bus or subway, and probably 80% of the people on the bus have a game on or a phone on. So I think that's something that is affecting children. I think diet is a problem. We do have some of what they're eating is not good, and I think we just need to regulate that diet. I think that's one thing where I think the new Secretary of HSS Kennedy may have a point, is that the processed foods and the diet that the children are eating may not be healthy. At least we should be looking at it and to understand where the harm is and where the good things of it are. So I think that's part of it too.
Yeah, there's been so much criticism, over RFK from some parts, but other people would just say that actually he's the first person in a long time just saying things straight up that, look, there's a health problem and we've got to address it. That,
Yes.
and I wonder if too much is hidden behind, and I wasn't going to say science, but whereas for a generation we've spent a lot of time just being over classifying things. We've been thinking too much about complex solutions, whereas actually, kids, health, running, good diet, maybe is at the core of trying to defeat illness.
Yeah, I think it's important. The other problem with dealing with pediatrics is that any study, any research, the outcome can be a year from now, can be 10 years from now, can be 20 years from now. When we look at heart disease, we know that they knew from Vietnam, soldiers died in Vietnam, 18 years old. When they looked at their heart vessels, they were finding plaques, early coronary artery disease in 18-year-olds. So it says to you, wait a minute, this is starting pretty early, and it's just a slow process, and it takes a long time to get to a critical dimension where you're having chest pains and a heart attack and all that sort of business. So that's a challenge of trying to study some of these problems, is the outcome could be years down the road, and how do you design a study to follow that problem and follow the impact of any intervention.
I suppose to finish up, I would just ask, as you look back on your incredible career over decades, what is the one thing that has perhaps surprised you the most, or that has affected you the most, perhaps as well?
Well, one thing that's affected me fairly significantly is I have a younger brother who has Down syndrome. And he's now, it's funny when I say younger because he's 67 years old. There I learned a ton from my parents. So when he was born, my parents were approached by the hospital and told that he should be put into an orphanage or a foundling place and my parents said, look, that's not our style. That's not who he is. He's part of our family. And so they brought him in. He was part of the family. Whatever was going on, he was involved in it. And so that had a profound effect on how I approach problems. I wanted to be able to, as we deal with children with disabilities and with illness, we kind of keep them in the mainstream. What's going on? So that's had a big effect. The other thing is that I thought that I talked to is involving others in the care of children was really important. It's not just the doctor. So one of the things that we were really, and I'm really most proud of, is that when I took over at Cornell, was involving play. Having a child get through an illness, and this relates to some of your earlier questions, is more than just a pill and taking medicine and stuff. It's also the whole environment of care. And so we were really aggressive about building up our child life program so that we have people working with our patients while, because if I don't know if you've ever been in the hospital, but you spend, there's like 90% of time is just total boredom, where you're sitting around doing nothing, going crazy. This way, so we filled in those gaps by building our child life program, and they were essential. one of the things that they told us is we were doing procedures. We had one of the largest burn units in the city of New York, is at Weill Cornell and New York Presbyterian. And so part of the treating a child with a burn is they have dressings on their wounds and they have to be changed every couple of days or so. It's a painful procedure early on in the changing. So what we did in the past was we would give them medicine to sedate them so that they didn't feel the pain, because we're very risk adverse towards pain in children. The problem was the procedure took us 5 minutes, and then the child was sleeping for hours after, because that's the secondary effect of the sedative drugs. So our child life people came to us and said, look, we think we can deal with this by distraction and some of the things that we do with children. And they were right. And so we expanded our programs to have our child life people actively involved in the care of patients. If they were going to, again, you've been through it, MRI scanners. I'm in terror inside the MRI scan. They in the past, we would sedate child to go through the scanner. Now we can use the child life person and parents to distract them, and we can get through the procedure without using medications. So I think one of the things that I'm really most proud of is the involvement that we had in building the play part of our hospital care environment.
Yeah. Well, I mean, I know how much incredible work you've done over your career, and I suppose I want to thank you for that, first of all, and I suppose all the children want to thank you for that as well. So thank you so much for speaking to me today, for your career as well, and what a great pleasure to meet you.
It was a pleasure to meet you. Listen, thank you. Good luck. I hope it works out.
Thanks for listening to Searching for Heroes. Listen ad-free with a Fox News Podcasts Plus subscription on Apple Podcasts, and Amazon Prime members can listen to this show ad-free on the Amazon Music app.